GERAS came together from a number of researchers and educators who at Hamilton Health Sciences and McMaster University, we want to ensure that number one, we train the next generation of healthcare professionals in caring for seniors. A second really important focus when we had these discussions in forming these centers is we really wanted seniors to be an integral part of the development of the center and really inform us how they want their future health professionals to be trained. What type of research are they interested in? What are unanswered questions in their health care? And so those are really two very important pillars of our new center. It is really very important to be developing this center for seniors in Hamilton and our surrounding region. We have one of the largest growing populations of seniors across Canada, and we want to ensure that seniors live their best lives.
All of us age. We all age at the same rate, one day at a time, but some of us are further down that road. Our GERAS Education Centre focuses on three main topics because they're the low-hanging fruit right now. One of those items is falls and fracture care because many older individuals have falls and will succumb to having a hip fracture or wrist fracture.
Well, my name is Vera Tomlinson, and I'm now 101 years old, so they tell me. I go to Dr. Papiona because she started my real care for my osteoporosis.
And we want to avoid the next fracture. We want to avoid complications from their injury while they're in hospital, be it delirium, be it ulcers, be it deconditioning. So by focusing on that area, we improve quality of life and ideally even prevent the fall and fracture in the first place.
Well, I think what has helped me considerably is the fact that I'm getting the right kind of medication together with the fact that I've tried to keep active. I tried to follow a guideline that Dr. Papineau has set for me, and she said I could have ice cream, so I have lots of it.
Another area of interest that we have is cognitive impairments of such extent that constitutes a diagnosis of dementia.
Dr. Mazarzik would take Joni and do certain tests, and he would explain what he saw, what level he thought she was functioning at. He thought she should be functioning lower, and he wanted to know why she was functioning higher. What were we doing?
Right now there's no cure for any of the dementias, but there's many things we can do to help individuals out.
It's been an interactive conversation with the doctor. I say what I'm doing, he makes suggestions, what I might try, and I bring that home and try it and see how we can incorporate it.
And by studying all these steps along the way, prevention, treatment, knowledge transfer for caregivers and other persons, be it in hospital, be it in long-term care, be it paramedics, we can help the quality of life of these individuals.
I can't say enough about him. I really appreciate all he's done.
It's not just geriatricians, doctors for older people like I am that have to look after these persons. It'll have to be everyone. Family doctors, other specialists, and even arming the public with information of what to look out for and what to do to make her brains healthy and to offset this as much as possible. The third theme of research we want to do with our GERAS Education and Research Centre is focusing on palliative care. This is providing comfort care for individuals in the last years of their life because they're dying of some sort of known problem.
My name's Rob Russell. My mother, Jean Russell, was at St. Peter's for almost 2 years to the day, from March of 2010 to March of 2012 when she passed away. I would say they kept her very comfortable. She wasn't in any pain, which was it's always a concern for any family that has a loved one in the hospital, that you don't want to see anybody in pain. She was not in any pain. She was given her drugs, and she was kept very comfortable.
We want to be with them on their final journey. We want to provide them as much care and comfort. We also don't want to provide unnecessary interventions that are not felt to be helpful. So by studying the wants and needs of these individuals and these families, and also sharing information to our partners in acute care, family medicine, subacute care, we can better look after these individuals and give them the care they want in the places they need it.
She had developed another type of cancer that we were told. And we were told she'd make, a couple, 3 weeks that she would survive. And, we were prepared for that, and she went 2 years in St. Peter's.
I see our GERAS Centre almost like being a dandelion clock, a little dandelion clock, and you blow it and it scatters seeds everywhere. We want to be that dandelion that sheds information everywhere and on fertile grounds. It'll grow and spread and do the same.